Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola with Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, we're still talking about endocrine pharmacology, and our next stop has to be the discussion of antineoplastic agents. You know, medications used to treat cancer, which we used to call chemotherapy. Well, how do these drugs work? Well, we all know that cancer cells have a very high mitotic rate. They divide much more rapidly and reproduce much more rapidly than cells that are normal cells, if you will. So that's one of the ways we can test for cancer, is by testing the mitotic rate of a bunch of cells that sort of look suspicious. Well, if you know that about cancer cells, then it seems pretty obvious that the way to get rid of cancer cells, or to kill the cancer, is to use medications that focus specifically on rapidly reproducing cells by interfering with their reproductive cycle. That makes sense, right? Seek out the cells that are rapidly dividing and, interfere with that process. Well, that does work, and it does work rather well sometimes. But the problem is these medications can have effects on normal, rapidly dividing cells in your body. Like what? Like the cells that make up the lining of your stomach, which is one of the reasons why people who take chemotherapy or antineoplastic agents have severe bouts of nausea and vomiting. What else? Hair follicles, okay? Which is why patients who take antineoplastic agents sometimes lose all of their hair or part of their hair. And bone marrow, okay? Bone marrow is rapidly dividing, so if I suppress that growth, I'm really causing what? Bone marrow suppression, and that can lead to what? Decreased immunity and an increased risk of infection. So antineoplastic agents have the effects on rapidly growing cells that are normally rapidly growing cells in your body. But I can think of another place too, and that's right here, okay? The cells that make up the lining of the oral cavity are also normally rapidly dividing cells. So of course chemotherapy is going to cause oral side effects, like what? Oral ulcerations, altered taste, gingival bleeding, candidiasis, and of course the dreaded oral mucositis. Now mucositis is bad enough on its own. It's horrendous and very painful, but the real problem with mucositis is that once you've experienced it, you may never want to take your chemotherapy or antineoplastic agent again, and that can lead to a shorter lifetime for you. In addition to that, we're worried about xerostomia and damage to the salivary glands, especially if it's incorporated with radiation. So these antineoplastic agents have effects on normal cells too, which can affect the quality of life of the patient. And that's why we always make sure we partner with our friends in oncology, that for any newly diagnosed patient with cancer, they come to see us in dentistry immediately so we can clean them up, make sure we remove any teeth that are, borderline, and insist on scrupulous oral hygiene, because that's going to be the best way to rule out the potential for these oral side effects. Keep in mind that these drugs do such a good job at suppressing immunity that they're actually sometimes used to treat autoimmune diseases. That's for another episode, my friends. So this is Tom Viola. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Facts.